Okay, so hi everyone. Now we're going to be looking at the last type of abnormal sound, which is the extra hard sound. So far we spoke about the S1 and we spoke about the S2. So S1, commonly thought to be a result of the closure of the mitral and the tricuspid valves, and also signals the start of systole because that's when systole starts, when the mitral and the tricuspid valves close. And then you have S2, which is the start of diastole because you have the closure of the aortic and the pulmonary valves, and and that's what you have as S2. So you have S1 and you have S2. But you can have what we call extra hard sounds, and you have two main types of extra hard sounds, S3 and S4. So S1 and S2 are normal, but S3 and S4 are abnormal. Okay, so let's see what we can find about S3. S3 is mid diastolic, so all of the added sounds are diastolic sounds. There is no abnormal extra hard sound in systole. You always have S1, S2, and then after S2, which is diastole, you have either S3 or S4. So that's very important to understand. So let's talk about the two. So we know that S3 is mid diastole, whereas S4 is late diastole. That's one of the ways you can tell them apart. So you often find people saying that you could mimic the rhythm of S3 by the phrase Kentucky. So Kentucky, 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 and S4 with Tennessee, 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 Tennessee. Subtle difference, but you'll notice that S4 is late diastole, so it's going to be slightly after, which makes sense. That's why it's called S4. And S3 is mid diastole, it's going to be before. And then also the other difference is with the pitch. So S3 is low pitched and S4 is higher pitched, which one of the reasons you could listen to the bell, because the bell will allow you to amplify those lower pitched sounds. Okay. And I really suggest that you listen to some of these sounds on YouTube, but you would hear something like three sounds, okay? As opposed to the normal lub dub of the S1 and the S2. And here's just a whole list of different causes, and if you read Talley and O'Connor, you'll find they give different mechanisms, but I suggest that you just try and memorize some of these causes. So right ventricular S3. So remember, you could hear the S3 on the left, or you could hear it more on the right, and that's important because they have different causes. So if you hear a right ventricular S3, that's more suggestive of either right heart failure or constrictive pericarditis, whereas a left ventricular S3 is more suggestive of a left heart failure or an aortic and mitral regurg. With the S4, a right ventricular S4 is more suggestive of pulmonary hypertension or pulmonary stenosis, whereas the left ventricular S4 is more suggestive of aortic stenosis, acute mitral regurgitation, or systemic hypertension. And those are the causes. So I hope that this makes sense. Very important to understand, I actually forgot to mention this in the first video, that how do you know which sound that you're listening to is S1 and S2? And this is why you have to, when you're listening to auscultation, you actually have to feel the pulse. You should feel the radial pulse, because if you feel the radial pulse, that tells you that you're in systole. So if you hear a heart sound that corresponds to systole, then that heart sound must be S1, because we said that that S1 signals the start of systole. So if you hear a heart sound with systole, then that heart sound must be S1, and that's why you feel the heart sounds, you feel the pulses as you're listening to the various heart sounds. I hope this video makes sense and you have a better understanding of the abnormal types of heart sounds.